you have any questions, we have industry perspective here. We have the biggest referral hospital in the country. And I see Mbugo, before I could even finish my sentence, he wants to ask a question. So somebody please get Mbugo here, a mic.
Do we have a standards document for healthcare data? You said the information system has just gone live at KNH. Can we get visibility for that? And now for PwC, is there a document that you can share that could inform the rest of the people who are invested in that space of where they can literally plug in?
Yes, we have a standard document, and the standards are not only for data alone. We have standards even for the practice, and all those are going to be put in the ICT process so that we can standardize and also guide other people who are in the counties, because nursing or health sector, if we don't standardize, we are going to have medical errors which are going to be dangerous. And in our Vision 2030, we have said that we want to give high quality of life to the Kenyan citizens, which is going to be given in a safe environment, and it is going to make people more healthy and more productive.
Can I just play devil's advocate, Philomena? Standards are great, and it looks like you're trying to put the proper documentation and benchmarking there. But how about the implementation? Because too many government agencies have all the right policies in place, but they don't get implemented.
Thank you very much.
Yes, Johan.
Thank you. The standards are cut across the Ministry of Health, which has been two ministries. They have standards, they are connected to the counties, and they are the ones who regulate the standards. And we also have the regulatory bodies, which are charged with the responsibility of regulating the practice.
All right, Mushemi.
In answer to your question, yes. What we did was we started with a feasibility study that showed how many of the projects. Initially, there was a project done ahead of ours, and that isolated how many IT projects were required to actually transform Kenyatta National Hospital. The number came to about 70 projects, and they were going to cost a lot of money to do that. So what we did was we did a feasibility study to find out which of these projects were bankable. We've completed that, and now what we're doing is we also did a market sounding to figure out whether private companies would be willing to invest in the hospital as well. That having been done, we are now preparing documents that are going to be bid out so that we can get what we are calling a partner to try and roll out this project. And so you'll be seeing adverts coming out in the newspaper to try and engage people in that process.
Yes, sir, you wanted to comment?
Yeah, just because this question of standards is so of vital importance, I think what you need is semantic interoperability, and what most of the world is going for now is IHE, the so-called IHE standard, and that is an open standard, so you can exchange data between different software, and that's, I think, the most important thing starting infrastructure for health.